you are listening or watching Radio Afinju. The time is 4 p.m.
Ẹ bá mi pè o, kí lorúkọ rẹ̀? Rédíò Àfínjú, gbogbo èèyàn ló ń gbọ́ Àfínjú, gbogbo èèyàn ló ń gbọ́ Àfínjú. Lórí WhatsApp Àfínjú, Instagram Àfínjú, Facebook Àfínjú, lórí X Àfínjú, lórí YouTube Àfínjú, lórí TikTok Àfínjú, kí lorúkọ rẹ̀? Àfínjú. Ẹ bá mi pè o, Àfínjú, rédíò Àfínjú, gbogbo èèyàn ló ń gbọ́ 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 Àfínjú, rédíò Àfínjú, rédíò Àfínjú, rédíò Àfínjú.
Stay informed with news on Radio Afinju.
This is News Alerts on Radio Afinju.
Good evening and season's greetings. Here is the news alert on Radio Afinju. A non-governmental socio-philanthropic organization, Oroki Crystals Club, has disbursed 50,000 naira each to not less than 10 indigent patients at the Department of Medical Social Service of the Osun Teaching Hospital in Osogbo to support their treatment under its Access to Care initiative. The cash support, which was done at the hospital premises, had in attendance the founder of the club, its president, the vice president, and some other club executives, along with some medical staff of the unit. While speaking with our correspondent, the club's president, Bello Muideen, highlighted that the initiative aims to inspire other concerned citizens to engage in a structured program focused on improving the lives of the less privileged in society, emphasizing that the government alone cannot accomplish this task.
This morning we are at Osun State Teaching Hospital to see what we can do to those people on sick bed who are unable to pay their bill for one reason or the other. This morning we shall be giving out about 750,000, starting with 500,000 this morning for 10 people at the rate of 50,000 per patient. That's why we're here, my brother. We look at our environment. These are the government contribution and the well-meaning people in the society. The basic aim, even if we bring 1 billion naira to this environment today, we know it will not be enough to cater for the need of the sick patients. This is a reawakening call for the people that are well to do in the society to give out part of what God has endowed them with to touch life of the less privileged in the society. That's just the sole aim.
Bello, who maintained that the beneficiaries were selected without prejudice, added that the intervention focuses more on patients with critical health conditions.
About 3 weeks ago, we contacted the medical social services of the organization, which is Osun State Teaching Hospital, to know those people who are unable to pay their bill. Actually, about 20 names were sent to us out of the lot. They said there are so many, but the light cases among them, because even on the list, I could see people that cannot afford 100,000 to about 500,000. So the name was sent to me. I don't know any of them. Even up to now, as I'm talking to you, I have not seen any of them physically. But we are going to be giving them one-on-one that cash. We are not handing over to any staff. We shall be visiting the ward to give them that money.
He lauded the management and staff of the department for the friendly reception the club received from the hospital. In the same vein, the Vice President, Adekola Adebowale, also seized the moment to thank their sponsors while noting that most of the contributions were from the members of the club.
As a club, we contribute as each member contributes, and then above all, we have some legend among us. We have the sponsors, our patron, our matron. Let me just seize the opportunity to appreciate our patrons, both within and outside the country. Also the matron, both within and outside. So I want to thank them that God in infinity mercy will continue to bless them and reach their pockets.
Speaking on behalf of a beneficiary, James Michael praised the club for such initiative, saying that the donation came at the most present time. He narrated that he lost his sister after spending 2 months at a hospital, which made his family financially incapacitated. He added that his father also gave up the ghost on the proposed day of moving his sister's corpse from the hospital mortuary.
We have been here for around 2 months, but unfortunately, my sister gave up last month. So our dead body is in mortuary since like 2 months now. But we thank God that even the day we even planned to come and carry her, the that day I lost my dad too. So we have to just spend it. So yesterday we came around to come and take her. So we are not able to pay for the mortuary because since our body is kept there, they'll be managing our body for some months till we get the money. So unfortunately, we reached out to the social work and they told us that we should carry the dead body, and by God's grace, if any help should come, then they will see to it.
Speaking with our correspondent, the Assistant Director of Medical Social Work of the hospital, Elizabeth Onyedamola, called on other individuals in the society to extend their act of kindness to indigent patients, as the health sector also needs assistance.
Yes, the call that we can make to them is that we always tell people to come to the hospital like this to see people that are suffering, that they have no strength, they have no money, they have no family. We have people that they don't even have anyone staying with them, and they are always been in need of help, monetarily, emotional support, and a lot of help. We always tell, even like people that came now, we always employ them that they should not forget coming again, and they can see help us to tell their friends and family that this teaching hospital needs more help for our indigent patients.
Part of the club's philanthropic projects includes free medical outreach, annual awareness walks, free screening campaigns, and support for underserved communities. And that was the news alert on Radio Afenju. To view our channel, please follow Radio Afenju on Facebook, X, and YouTube. My name is Stella Abderonti. Thanks for listening.
That was News Alert on Radio Afenju.